Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer and I'm joined today by neurosurgeon Dr. Christopher Kalhorn and neurologist Dr. Yasar Torres-Yaghi. And they're both from MedStar Georgetown University Hospital. And today we're going to be discussing movement disorders like Parkinson's disease, essential tremor, and dystonia, and how we can help reduce your symptoms and improve your quality of life. If you'd like to know more about the medical management, evaluation, and treatment options for movement disorders, including deep brain stimulation, or DBS, then stick around, give us a like, share this with your friends, and if you have questions, leave them in the comments below. We also, like I said, encourage you to share this with your friends to let them know that you're watching and so that they can tune in as well. Dr. Kalhorn, Dr. Yaghi, thank you for joining us today. We know you both are very busy, so we appreciate you being here. And before we get started, can you guys both just give us a little bit about yourself and what you do here at the hospital?
Sure, I'm Chris Kalhorn. I'm a neurosurgeon, and my area of surgical expertise is deep brain stimulation surgery for patients with movement disorders. And I've been here at MedStar Georgetown about 20 years now.
Okay. And I'm Yasar Torres-Yaghi, as was mentioned. I actually did my residency at Georgetown and trained under Dr. Kalhorn, became a movement disorder specialist, and worked very closely with the neurosurgery department to be able to care for our patients with Parkinson's disease and other movement disorders with medical management and neurosurgical management.
Great, thank you both. So let's get into the questions. First off, what are movement disorders and what are some of the common types you treat?
Great. So we're a big tertiary care center, and here we tend to see cases that fall all along the spectrum of movement disorders. When we think of movement disorders, the term is a relatively new term, but what we do is we care for patients that have Parkinson's disease and other types of Parkinsonisms, which are caused by a dopamine deficiency in the brain. For example, we have Lewy body disease is a type of movement disorder. We have multisystem atrophy and other types of atypical Parkinsonian disorders. Other than that, we tend to see patients with essential tremor, which can affect many people in the United States, as well as certain generalized dystonias.
Okay, and so what causes these movement disorders? Are there certain people who are more at risk, or is it genetic? What causes them?
Great question, and we're learning as the decades go by. We learn more and more about the different causes of all of the different syndromes that we take care of. In Parkinson's disease, we know that age is a risk factor. There are certain things that we think can trigger one's genetic predisposition to develop Parkinson's disease. In particular, we think about things like pesticides may actually increase the risk of developing Parkinson's disease.
Okay.
Things like trauma. So in certain sports players or boxers' cases, we might see an acceleration of Parkinson's disease due to repetitive trauma to the head.
Okay. Cool, interesting. So what are the symptoms of movement disorders that people should look out for?
Yeah, so that's part of what we do at a big center like ours. We do tend to see patients that come in, and their chief complaint, we call it, might be tremor. And we'll see them and we'll say, okay, well, what kind of tremor is this person experiencing? Are they experiencing a tremor from just a physiologic tremor that could be due to maybe too much caffeine? Or are they experiencing an essential tremor from a part of the brain that controls movement? In essential tremor, we see that whenever we evaluate a tremor, we see if it's present at rest or with action. For benign essential tremor, many times our patients might experience tremor while holding things. As opposed to Parkinson's disease tremor, we might see a tremor at rest in association with other symptoms like slowness of movement, gait impairment, and stiffness and rigidity.
Okay, and now how would you, what kind of tests would you do to figure out what you just said, and where should they start? Like, should they start with their primary care doctor talking about this, or what doctor should they start out seeing?
So when we talk about everyone's journey, it's interesting to see people in our office that come in I always tell our patients, everyone has a diagnostic journey and a therapeutic journey, and everyone's diagnostic journey is different. And so people can have different stories of what brought them here. They might have a tremor that's been there for 10 years. And it's, 10 years later where they come into our office and we might have the conversation that, this might be a Parkinsonian-like tremor. But the way we evaluate cases is very much dependent on our clinical examination. Neurology and movement disorders in particular is very much guided by how it is that our examination looks like. Although we do MRIs of the brain, different other parts of the spinal axis, so we can do the MRI of the cervical spine all the way down to the lumbar spine. We do everything when we need to find the right diagnosis. In particular for Parkinson's disease, to distinguish between Parkinson's disease and essential tremor, which tends to be one of our diagnostic questions, we can perform a dopamine active transporter scan, which is a nuclear medicine scan that can distinguish between essential tremor and Parkinson's disease.
Okay. And so for people living with a movement disorder, you talked about they could have a tremor for 10 years and then come in. How does it affect their everyday lives if they're living with one?
It's a great question, because, that relationship between symptoms and the functional impact that these symptoms might have, it's unique to each person. And so you might have someone, for example, that's a young onset Parkinson's patient who's still working and still wants to be able to use their limbs and use their hands. For example, more recently I saw a teacher that, she's working now virtually and having to see patients through the computer, and she's noticed that her tremor and more so her stiffness, and which is also called dystonia or rigidity, is impairing her ability to type on the keyboard. And so we really do see a huge functional impact from these movement disorders, but it can vary from person to person. There are some people that might have more profound impairment of walking or their gait, more so than tremor. And there are some patients that may not have tremor at all, but they still do have a diagnosis of Parkinson's disease.
Mm-hmm. And so you talked about more the physical effects of your everyday life. How does it affect patients mentally? Like, do they deal with a lot of depression, anxiety, other sorts of things going through this?
Yes, we think about Parkinson's disease and many of the movement disorders as a multifaceted issue. So it's not just the movement disorder. A lot of the times, in particular for Parkinson's disease, we think about it as a deficiency in dopamine, but there is also a dysregulation of other chemicals or neurotransmitters in the brain, such as serotonin, acetylcholine, and some others. And that can lead to things like anxiety, depression, sleep disorders like acting out one's dreams, talking in their sleep, sleepwalking. Constipation tends to be a major factor in Parkinson's disease as well.
Okay. Well, thank you for that. If you're just now joining us live or watching the replay after, thanks for tuning in. We're speaking with neurosurgeon Dr. Kalhorn and neurologist Dr. Yaghi discussing movement disorders. And we have more to talk about, so keep watching. Share this video with your friends. Give it a like to let us know you're watching. And if you have questions, leave them in the comments below. So what treatment options are available for movement disorders?
So beyond the medical management of movement disorders, we also have surgical technology known as deep brain stimulation surgery. This is a surgical technology that can be used to treat people with Parkinson's disease, essential tremor, and dystonia. This procedure in Parkinson's disease can be very helpful for motor symptoms such as tremor, bradykinesia, slowness of movement, dyskinesia, and can also help us reduce the amount of medication that people are taking after surgery.
Okay. And so kind of talking about medication, would you say it's better for your quality of life to go with the deep brain stimulation and kind of lessen the medication like you said, or does it depend on the patient? Like who would you recommend this surgery to?
So as Dr. Yaghi said, we see people at various spectrums of their disease. So it's not an unusual situation for me. Sometimes I'll be referred someone who's been fairly recently diagnosed with Parkinson's disease. And for most of those individuals, we can treat their movement symptoms medically in the beginning. But as the disease progresses and there's loss of more dopamine-producing neurons in the central nervous system, the motor symptoms can become more severe and difficult to manage. So it's really in that situation where people are having motor symptoms that are not being well controlled medically that we start to have a conversation about possibly using deep brain stimulation to treat their Parkinson's disease.
Okay. Can you talk about medication management of movement disorders?
Sure, Dr. Yaghi, you want to comment on that?
Yeah, so when we think about this relationship between the neurosurgical fields and the neurology fields, it really is this interplay between surgery like deep brain stimulation and medication management. As Dr. Kalhorn mentioned, in many successful cases, we can see a reduction of the overall medications that our patients have to take. The good news about Parkinson's disease care, for example, is that there's a lot of different medications in 2020 to be able to help our patients. Mm-hmm. Actually, I would say there are close to 30 different medication options for our patients in 2020, which has changed a lot, even in the past 10, 20 years. We've been able to offer patients different types of oral therapies and use them in combination with their surgical treatments. So for deep brain stimulation, we might have patients sometimes on 3, 4, or 5 medications to help provide that stability over time.
Okay. And with deep brain stimulation, is there a certain, I know you said it kind of varies from patient to patient, but is there a certain age range that you tend to, do this surgery on more? Or?
So we see patients of varying ages. We've operated very successfully on patients in the past that have young onset Parkinson's disease. As Dr. Yaghi mentioned, a lot of them are trying to improve their quality of life so they can continue to work. And we've operated on patients all the way up until their late 80s. So it really depends on their other medical conditions or comorbidities. We have to make sure that it's safe for them to undergo anesthesia in the surgical procedure. So it's a very wide age range. Okay. I'd say the average age of our patients is probably in their mid-60s or so.
Okay.
Early 70s.
Okay. And now, what sort of questions should somebody be asking their doctor to get the best treatment for their movement disorder, and have, what kind of conversations should they have to make sure they're getting the most out of their visits and their treatment?
Yeah, so when we think about the different, that's a good question about the therapeutic journey that our patients kind of undergo after their diagnostic journey. And they finally have this diagnosis, and we're trying to give them kind of a hopeful message of what we can do. And there's a lot that can be done. We always need to make sure that they're doing everything right? So they're doing all their exercise routine aside from their oral therapies. They're checking in with their doctor, their neurologist, their movement disorder specialist, making sure they're also checking in with their neurosurgeon on a regular basis, so that we don't lose touch with our patients. That's something that we've done more recently with the pandemic, making sure that we stay connected with our patients. Communication tends to be one of the most important parts of our field, because there's a lot of intricate things that we do to help people. We put them on many medications like we talked about, and we try our best to take care of our patients. But it's not just surgery, it's not just medications. It's also very much dependent on the patient's well-being and how they feel, and all of the different exercises that they can do with physical therapy, speech therapy, occupational therapy. There's a lot that can be done.
Okay, great. Well, is there anything else that you would like to add about deep brain stimulation?
I think it's important for patients to know that deep brain stimulation is a very safe surgery. It's been around for a long time. There have been studies that have compared best medical management alone to deep brain stimulation therapy, and patients who undergo DBS tend to do much better than just best medical management alone. So I think while for some of our patients initially they may be a bit intimidated by the idea of having a brain surgery to treat their movement problem, in experienced hands is a very safe operation, and it can be very effective for treating the motor symptoms. And this is a disease that doesn't just impact the individual, but their whole family. And so for patients who are looking for more motor improvement beyond what medication can deliver, I think it's appropriate for them to initiate a conversation with their movement disorder neurologist about, is this an appropriate thing for me to consider as a next potential treatment step?
Yeah. Yeah, and that's a great point that you brought up about it. Affects, their family too. It's a big decision to make, but it's good to know that it's safe, like you said. Is there anything you'd like to add?
Yeah, so when I first entered the field of movement disorders, I never would have thought about all of the different things that we can do as clinicians to help our patients. And anytime someone comes in our door and gets an evaluation and maybe a diagnosis, like Dr. Kalhorn, related to a deficiency in dopamine, like he said, our job is to really kind of find that right balance to be able to help our patients both medically and surgically. And our goal is to create what's called a dopaminergic tone. So to use the medications from all the different families to help people throughout their day so that they can improve their functional abilities, so that they can continue to work, as we said, continue to take care of themselves. And a lot of the times when we first get a diagnosis of Parkinson's disease, for example, at the average age of 60, our patients a lot of the time have kind of been planning for their retirement. And so there's a lot that comes along with it. And so it does, as Dr. Kalhorn says, it really does take a village and a whole community of care that we try to provide more of this kind of multifaceted patient-centered care that becomes so important for chronic neurologic diseases.
Yeah.
I think MedStar Georgetown as a National Parkinson Foundation Center of Excellence really provides this multidisciplinary care environment for our patients. We have neurologists, physical therapists, occupational therapists, speech therapists, neurosurgeons. Everyone is uniquely focused on that patient so that they have the best possible outcome.
Yeah, that's great. Well, that wraps up our broadcast. Thank you so much for joining us. We really appreciate it. And thank you to all of our viewers for watching. If you would like to schedule an appointment, please call 202-444-2333. And for more information about deep brain stimulation, you can check out the link in our comments below. Thank you so much for joining. We'll see you next time.
Thank you.